Before you document in your clinical paperwork, make sure that you know what the difference is between subjective and objective data. So today I'm going to clear that up for you. So if I were you, I'll go ahead and save this video. When you think of subjective data, I want you to remember that it is what the patient tells you. This is how the patient is feeling, the way they're perceiving things, and they're telling you, "Nurse, I have pain in my chest. I feel anxious. I'm really tired. I can't breathe right." Those are all subjective information. On the other hand, objective information are things that you measured and you assessed. So you listened to the patient's lungs and you heard crackles. That's objective. You took the patient's blood pressure and it showed 140/90. That's objective. So here's a scenario to help you think about it. You walk into your patient's room that you've been taking care of. You observe the patient gasping for air. As the nurse, you chart that the patient is having difficulty breathing. You ask the patient, "Mr. Smith, are you okay?" "Yes, nurse, I feel short of breath." The patient stated he feels short of breath. That's subjective. The nurse observed the patient looking like he has difficulty breathing. That's objective. So when you document it in your clinical paperwork, make sure you're documenting the one that you actually observed as the objective information and not just what the patient said. So next time you're thinking about subjective or objective data, just remember, subjective data, what the patient says, we can't measure it. Things like, "I feel nauseous." And objective data is the stuff that you observed. We can measure that. Things like the patient's blood pressure is 130/80. The truth is that you're going to have both subjective and objective information in your charting, but you want to always make sure that you differentiate which is which. If a patient tells you something that is subjective, you want to indicate patient states, patient notes, patient verbalized. And if it's something that you measured or you observed, then you want to go ahead and document it as objective information. And that's it. That explains objective versus subjective data. So next time you're charting or you're at clinicals, make sure that you're indicating which is which, because I know your instructor is going to call you out for it. Let me know if this video was helpful, and make sure you share it with another nursing student who might find it helpful as well. Until next time, I want to know what topics you want to see next. Leave them in the comments. All right, guys. Bye-bye.